We are Sean
Maria,
and Denisa
from Barbados,
Ireland,
Germany,
Bahrain,
Spain,
Austria,
Poland,
South Africa,
Kazakhstan.
So our COVID lockdown began March 29 initially with a 6 p.m. to 6 a.m. curfew. It is now a 24-hour curfew except for essential services. Now, as a physician, I can still go to work, but must travel with a government-issued pass and ID. I'm also an avid tennis player and no longer able to play because our beaches and parks are now off limits. I spend more time reading and watching movies.
I usually work with Sean in the practice, but now I have to work from home online. I am now implementing a strict sanitization routine when Sean gets home from work. In addition to that, I'm unable to go to the grocery store as often as I would like, and so I also have to get creative with our meals.
I'm studying veterinary medicine at university, and because of COVID-19, we have online classes. Usually our classes are more practical work, but since there's online classes, I'm finding it very hard to adapt to this new style of teaching.
Hi, this is a short video from Ireland, from Dublin, about our lockdown situation. We're still allowed out to walk around for up to 2 kilometers, and I'm lucky I've got a garden I can go out in. But it's been a long time. I've been in lockdown since the 25th of February when we were sent home from our office in Italy. We were able to work from home because we have good digital systems available to us, which is great. We're doing a lot of cooking like lots of people, getting a lot of gardening done. We're lucky it's sunshine today. And
Of course, sitting at home, it's not so easy. It's quite boring. Also, all the time you're at home. But we entertain ourselves by reading books, by listening music, dancing, having fun, and making different kind of cookies, pies. And we do homework with our kids, of course. And please don't be panic. Just wear a mask. Just follow all the rules that is in your country, and please keep your hands every day clean, so this disease will not touch you. Just we have to be positive, to pray, of course, to God, and the situation will change very soon. It's 7 p.m. and as you can see, there are several people just in a street, and it's prohibited to go outside, and the penalty will be $60.
Kai here from the Austrian Economic Center. I'm here in the south of Germany, and I have to say Germany has been doing remarkably well, relatively speaking, when it comes to tackling the coronavirus. We've had about 130,000 cases so far. Half of those have already recovered from the virus. There have been about 3,000 deaths, but the death rate is much, much lower than in countries like Italy or Spain, where it has been between 8 or 11%. Here in Germany, it's 2%. Last week still, the UK had about half of the cases of Germany, but about 3 times as many deaths. We have had a lockdown, but the lockdown hasn't been as severe as in other countries. People can still go to work and people can still move around as long as they have a semi-good reason for it. I think there are 2 main reasons why we are doing very well. One of them is that our healthcare sector is very well equipped. We have the most hospital beds per capita among major European countries, for instance. And the second reason is that we've been testing a lot. We've been testing very early and we've increased our capacity. At this point, we have the capacity to do about 500,000 tests a week, much, much more than in any other major European country. And now politicians are talking about lifting restrictions, and I think this will happen in the next 1 or 2 weeks. So Germany has been able to get through this, at least so far, without too much drama.
Bahrain is a small country with the airport currently being the only way in or out, and only Bahrain citizens are allowed to enter. Everyone is screened and then tested if showing any symptoms. All arrivals also have to self-isolate after that for 14 days. This may go some way to explain the small number of cases so far, with only around 1,000 positive cases and just 7 deaths from a population of 1.5 million. There is no lockdown here, although everyone is encouraged to stay indoors and work from home where possible. The wearing of face masks is compulsory in public. Gatherings are restricted to a maximum of 5 people, and no more than 2 people are allowed in the same car together. But that's about as far as personal restrictions go, although social distancing is encouraged and generally adhered to by most.
Hi, we live on the Costa Blanca in Spain. We're on our 5th week of lockdown. The isolation has meant that we can only take a single journey out to the supermarket or the chemist or the bank or the petrol station, but it's definitely got to be a single person in a car, and under no circumstances can it be any other situation. There's lots of checkpoints and fines being issued.
Yeah, we work in the events industry, which has been really affected by all of this, of course. So we're looking at some way that we can adapt for the time being and possibly work online, but also, you know, just trying to keep a little bit active, do some exercise and stay healthy and have a calm mind and approach to all of this. Meditating every day is a good thing that we've started doing since all of this began. And who knows, it's quite uncertain times as to what will happen from here.
After 4 weeks of containment, wearing masks and sitting at home, we hope that the reopening of the shops as of yesterday will slowly get us back to normal life. However, we have to wear masks not only in public transport but also when we go shopping. We have to wear masks when there is more than one person in the same car. Life will be completely different than it was before. Social distancing is a matter of fact, and we have to do so, otherwise there will be severe measures. There's no more meetings, no more public meetings with more than 5 people allowed. So far we were lucky, and people were very strict and were sticking to the rules. We do hope so that this has saved our country. However, we have to look at what will happen in the rest of Europe.
Hi, my name is Pierre. We are here in the Western Cape, nearby Cape Town in South Africa. My operation here is a nursery, but obviously it's not operational at the moment because of the COVID-19. How do we cope with the COVID-19 restrictions here? Well, there's a bit of a civil unrest. The poor are the ones that suffer the most, obviously. Besides that, the shops are well stocked, so we do not have shortages as such. I think the confinement is ridiculous because there's not that much death compared to others, so there is some kind of a resistance towards the restrictions, and we hope for the best for the future, and we should come out of confinement at the end of this month.
Hi, I'm speaking here from Poland. When the Polish government introduced the first measure to tackle COVID-19 pandemic about 10 days after the first case was recorded on 4th March. Then 10 days later, the government makes stricter regulations which banned all unnecessary travels around the country. Initially, Polish people responded positively, understandably to them, but since the government bans entries to such scarcely populated areas such as forests and parks, people are turning against the government